Do you know what dengue fever is? How it is transmitted? These are questions that are crucial to understanding this pervasive health challenge. Dengue fever is a viral infection that is primarily transmitted to humans through the bites of infected female mosquitoes, particularly the Aedes aegypti mosquito. This isn't your average mosquito though. These are found predominantly in tropical and subtropical regions, including parts of Southeast Asia, the Pacific Islands, the Caribbean, and Central and South America. So if you're planning a trip to these areas or live there, it's important to be aware. But don't let the geographical boundaries fool you. With the changing climate and increased travel, dengue fever is expanding its reach. This pervasive virus has a significant impact on individuals and societies alike, affecting millions of people each year. Now that we've set the stage, let's delve into the symptoms to better understand this disease. Dengue fever has a range of symptoms. It's a chameleon of sorts, presenting itself differently in each individual it infects. Yet despite its varying forms, there are certain signs that are commonly associated with the disease. The dengue virus often announces its arrival with a high fever. This is not your typical fever, but one that soars high and persists, often for several days. Alongside this fever, you might find yourself grappling with a severe headache, a throbbing pain that seems to originate from deep within your skull. But the discomfort doesn't stop there. You may experience pain that seems to linger behind your eyes, a sensation that can be particularly distressing. This is often coupled with joint and muscle pain, making even the simplest of movements an arduous task. Then there's the rash, a widespread eruption on the skin that can itch and burn. To top it all off, mild bleeding may occur, manifesting as nosebleeds or gum bleeding. These symptoms can be alarming, but they are the body's way of signaling that something is not quite right. Now, while these symptoms are certainly discomforting, in most cases, they are manageable. However, in some instances, dengue fever can progress into something far more severe. Dengue hemorrhagic fever and dengue shock syndrome are two such conditions. Dengue hemorrhagic fever, as the name suggests, is characterized by bleeding, blood plasma leakage, and low platelet count. Dengue shock syndrome, on the other hand, is marked by a sudden drop in blood pressure, leading to shock. If left untreated, these conditions can be life-threatening. They require immediate medical attention and careful management to ensure the patient's survival. It's important to remember that these symptoms, while distressing, are a call to action. They are the body's way of alerting us that something is amiss. Recognizing these signs early can make a significant difference in the course of the disease. Now that we know the symptoms, what are the effects of this disease? We'll dive into that in the next segment, shedding light on how dengue fever impacts individuals and societies. Dengue fever can have far-reaching effects. This isn't just about a few days of high fever and aching joints. For many, the encounter with this mosquito-borne disease is a prolonged battle that can stretch for weeks or even months. The relentless fever, the crippling muscle pain, the constant fatigue. These symptoms can leave individuals physically debilitated and emotionally drained. Severe cases can escalate into dengue hemorrhagic fever or dengue shock syndrome, requiring hospitalization and intensive care. But the impact of dengue fever stretches beyond the individual. It ripples out, touching families, communities, and society at large. When outbreaks occur, healthcare systems can become overwhelmed, straining resources and manpower. Hospitals become crowded with patients, while healthcare professionals work round the clock, battling to curb the spread and treat the afflicted. The economic toll is also significant. Productivity plummets as sick workers are forced to take time off. Businesses suffer, economies stagger. In developing countries, where dengue is most prevalent, this economic blow can be particularly devastating, exacerbating poverty and hindering development. And let's not forget about the psychological impact. The fear, the anxiety that comes with a dengue outbreak can create a climate of panic and distress. Understanding these effects underscores the importance of prevention. Because dengue isn't just a disease that affects individuals, it's a societal issue, a global concern that calls for collective action. Prevention is always better than cure, especially for dengue. So let's dive into some strategies that can help keep this pesky virus at bay. Starting with mosquito control, this is a crucial frontline defense against dengue. Mosquitoes, particularly the female Aedes aegypti, are the primary culprits for transmitting this virus. So we need to take measures to keep them away. One effective method is by eliminating their breeding grounds. Mosquitoes love stagnant water, so it's important to regularly clear items that can collect rainwater, like old tires, flower pots, and even discarded cups. But sometimes, despite our best efforts, these buzzing nuisances find their way to us. That's when mosquito nets and insect repellents become our best friends. Mosquito nets are excellent barriers, especially during sleep or rest when we're most vulnerable. And repellents? They're like invisible shields keeping mosquitoes at bay. Now let's talk about vaccines. Yes, there is a dengue vaccine available, but it's not a one-size-fits-all solution. Its effectiveness can vary based on factors like age and geographic location. Therefore, it's essential to consult with healthcare professionals to understand if it's a suitable option. Moving on to personal protection, it's another important layer of defense, and it's as simple as dressing appropriately. Opt for long-sleeved clothing, long pants, socks, and shoes when possible. This reduces the skin area exposed to mosquitoes. And remember, applying mosquito repellent on your clothing can provide an extra layer of protection. Let's not forget, these prevention strategies are not just for those living in dengue-prone areas. They're equally vital for travelers. So, if you're planning a trip to tropical or subtropical regions, make sure to pack your long-sleeved clothing and insect repellent. And of course, consult your healthcare provider about the dengue vaccine. In the fight against dengue, we all have a part to play. By taking these preventive measures, we not only protect ourselves but also contribute to the broader effort of controlling the spread of this disease. Remember, every mosquito we deter, every breeding site we eliminate, brings us one step closer to a dengue-free world. So let's stay vigilant, stay protected, and keep those mosquitoes at bay. Because in the end, it's not just about avoiding a few itchy bites. It's about safeguarding our health, our communities, and our futures. While prevention is key, what happens if someone contracts dengue? Unfortunately, there is no specific antiviral treatment for dengue. That might sound a bit disheartening, but don't lose hope just yet. Instead, treatment strategies primarily focus on relieving the symptoms and preventing complications, which can be equally impactful. In the fight against dengue fever, supportive care is the cornerstone. This involves pain relievers to soothe those nasty headaches and joint pains, and fever reducers to bring down that high temperature. Remember, it's crucial to avoid medicines with aspirin, as they can worsen bleeding. But the real game changer? Fluids. Dehydration is a real concern with dengue, especially in severe cases. So flooding your system with ample fluids is of paramount importance. This could be as simple as drinking water, or in more serious situations, receiving fluids intravenously. While it's true that we're still in search of a specific antiviral treatment for dengue, the focus on easing symptoms and preventing complications is a significant part of the battle. Despite the lack of a specific treatment, there is hope in ongoing research. Science is tirelessly working towards better solutions for dengue. As we speak, laboratories and research institutions around the globe are engaged in the relentless pursuit of more effective antiviral treatments and vaccines. The aim is to not only alleviate the suffering of those afflicted, but also to prevent the disease from taking hold in the first place. Key to this research are antiviral treatments. Although there is currently no specific antiviral medication for dengue fever, scientists are exploring new drugs that can target the dengue virus directly. This could potentially shorten the course of the illness or lessen its severity, reducing the impact on individuals and healthcare systems alike. In parallel, efforts to improve vaccination against dengue are also underway. The current vaccine has its limitations, but researchers are optimistic. Trials are ongoing for next-generation vaccines with the goal of offering broader and more effective protection. It's a complex task, given the 4 different strains of dengue virus, but one that holds great promise. Vector control measures, too, are evolving. One particularly innovative approach is the use of genetically modified mosquitoes. By reducing the mosquito populations or their ability to transmit the virus, we could strike at the very heart of dengue's transmission cycle. It's a bold strategy, and one that could have far-reaching implications for the control of other mosquito-borne diseases as well. But science alone is not the answer. Community awareness and education play a crucial role in the fight against dengue. By understanding the risks, recognizing the symptoms, and knowing what actions to take, individuals can protect themselves and their communities. It's about empowering people with the knowledge they need to act, whether that's removing mosquito breeding sites, using personal protective measures, or seeking medical help promptly when symptoms arise. With knowledge, vigilance, and scientific advancement, we can hope to manage and prevent dengue more effectively. Through the combined efforts of scientists, healthcare professionals, and communities, we are making strides towards a future where dengue fever is no longer a global threat.